Understanding pediatric growth and development milestones. Introduction to growth and development. Welcome to Growth and Development Milestones in Pediatric Nursing. What is growth and development? Growth refers to the increase in physical size, including height, weight, and head circumference. Development is the progression of motor, cognitive, social, and language skills. Why this matters in nursing? It helps us identify delays and abnormalities early. It guides parent education and anticipatory guidance. It ensures early interventions for optimal child health. The 4 domains of development. Physical and motor skills, both gross and fine motor abilities. Cognitive skills, thinking, learning, and memory. Social and emotional skills, interactions, attachment, and self-regulation. Language and communication, speech and comprehension. Key principles of growth and development. Understanding how children grow helps us provide better care. Cephalocaudal development. Growth occurs from head to toe. For example, infants control their heads before they can walk. Proximodistal development. Growth occurs from the center outward. Children develop arm movement before fine finger control. General to specific pattern. Infants start with reflexive movements. They then progress to voluntary, coordinated actions. What influences growth and development? Genetics and heredity. Nutrition and diet quality. Environmental factors. Overall health status. Quality of caregiver interactions. The neonatal period, 0 to 1 month. Let's look at what to expect in the first month of life. Physical changes. Newborns may lose up to 10% of their birth weight. They typically regain this weight within 2 weeks. Important reflexes are present: Moro, rooting, sucking, grasp, and Babinski reflexes. Motor development. Limited head control is normal. Hands are mostly closed. Movements appear random. Cognitive development. Sensory exploration begins. Babies respond to sound. They show preference for human faces. Social and emotional development. Bonding and attachment begin immediately. Newborns recognize their caregiver's voice. Infancy, 1 to 12 months. The first year is full of remarkable changes. Physical growth. Birth weight doubles by 6 months. Birth weight triples by 12 months. Birth length increases by 50% at 12 months. Motor development milestones. At 2 months, holds head up. At 4 months, rolls from front to back. At 6 months, sits with support. At 9 months, crawls and pulls to stand. At 12 months, walks with assistance. Cognitive development. Object permanence develops between 8 and 12 months. Babies understand that objects exist even when out of sight. Social and emotional development. Stranger anxiety appears around 6 to 8 months. Separation anxiety emerges around 9 months. Language development. Cooing begins at 2 months. Babbling starts between 4 and 6 months. First words appear around 12 months. Toddlerhood, 1 to 3 years. Toddlers are becoming more independent and mobile. Physical growth. Growth is slower compared to infancy. The anterior fontanelle closes by 18 months. Motor development. Between 12 and 15 months, walks independently. At 2 years, runs and climbs stairs with support. At 3 years, jumps and rides a tricycle. Cognitive development. Egocentric thinking is prominent. Learning occurs through trial and error. Problem-solving abilities improve. Social and emotional development. Parallel play is typical, playing alongside but not with others. Tantrums occur due to frustration and limited communication. Language development. Two-word phrases emerge at 2 years. Three-word sentences appear at 3 years. Preschool age, 3 to 5 years. Preschoolers are becoming more social and coordinated. Physical growth. Children gain approximately 5 pounds per year. They grow about 2.5 to 3 inches per year. Motor development. At 3 years, rides a tricycle and jumps. At 4 years, hops on one foot. At 5 years, skips and ties shoes. Cognitive development. Magical thinking is common. Understanding of time concepts develops. Social and emotional development. Cooperative play begins. Friendships start to develop. Language development. Children speak in full sentences. They know colors, shapes, and numbers. School age, 6 to 12 years. School-age children are refining their skills and becoming more independent. Physical growth. Slow, steady growth of about 5 pounds per year. First permanent teeth erupt. Motor development. Coordination and balance improve significantly. Increased ability for sports and physical activities. Cognitive development. Concrete operational thinking develops, as described by Piaget. Logical reasoning abilities emerge. Social and emotional development. Peer relationships become increasingly important. Industry versus inferiority stage, children develop competence and skills. Language development. Children read and write proficiently. They communicate fluently and effectively. Adolescence, 12 to 18 years. Adolescence brings dramatic physical and emotional changes. Physical growth. Puberty begins, typically earlier in females. Growth spurts occur. Muscle mass increases. Cognitive development. Abstract thinking develops. Formal operational thinking emerges, according to Piaget. Social and emotional development. Identity versus role confusion stage, adolescents explore who they are. Peer influence is at its strongest. Language development. Complex communication skills increase. Teenagers can engage in sophisticated discussions. Monitoring growth and development. How do we track whether children are developing appropriately? Growth charts. We use WHO and CDC standards. These charts track height, weight, and head circumference. Developmental screening tools. Denver Developmental Screening Test helps assess development across domains. Ages and Stages questionnaire identifies potential delays. These tools help us identify children who may need further evaluation. Provide timely interventions. Support families with appropriate resources. Recognizing developmental delays. Early identification is crucial for intervention. Red flags to watch for. No social smile by 3 months. No babbling by 12 months. No walking by 18 months. No two-word phrases by 2 years. If you identify delays, conduct comprehensive assessments. Refer to appropriate specialists. Provide family support and education. Implement early intervention services. Nursing care and parent education. As nurses, we play a vital role in supporting healthy development. Key nursing actions. Encourage stimulating activities like talking, playing, and reading with children. Provide nutrition guidance based on the child's age. Educate families on creating safe environments. Discuss baby-proofing, car seat safety, and injury prevention. Parent education topics. Age-appropriate play activities. Nutritional needs for each stage. Safety measures for the home and car. When to seek medical attention. The importance of routine well-child visits. Let's recap what we've learned about growth and development. Key takeaways. Growth and development follow predictable patterns. Each stage has specific milestones we should monitor. Early intervention is key to addressing delays. Parents and caregivers need our guidance and support. As pediatric nurses, we are advocates for children's optimal development. Thank you for watching. Understanding these milestones will help you provide excellent pediatric care and support families effectively.